If you're struggling with a stubborn IT band syndrome, make sure you watch this video to learn 3 unexpected contributors to IT band syndrome. If you're just foam rolling, it's probably not enough. This video was inspired by a patient that I've been working with over the past few weeks who had a flare-up of IT band syndrome, and we've been working with her and she's been gradually improving, but there have been a handful of unexpected things going on with her life and her IT band that have made a huge difference in improving her IT band once we address those. Hi, my name is Dr. Michael. I'm a physical therapist here in Evanston, Illinois at Valiant Physical Therapy, where we specialize in working with runners. And IT band syndrome is a very common problem and diagnosis that runners will suffer. And it can actually linger for a very long time if not managed properly. And these are 3 things that I always focus on whenever I am working with someone with an IT band syndrome, and they're not exactly super expected. Most people with IT band syndrome will try to foam roll and stretch the IT band, and while that may be okay for general symptom relief, it very rarely actually fixes and solves the problem. So the first of the unexpected contributors to IT band syndrome is, in my opinion, the thing that, if focused on intently, can truly solve the root cause of the IT band syndrome, and that is to focus on glute medius strengthening. So the unexpected contributor is glute medius weakness. The glute medius is a muscle that lives in the top of the hip. It's one of the glute muscles, and it intertwines and connects with the top of the IT band, and oftentimes the glute has the responsibility of stabilizing the knee, stabilizing the hip, and if the glute medius is weak, strengthening that and really focusing on strengthening that can actually have an effect down the leg and even all the way down towards the knee, where a lot of people will feel the IT band pain. Now, the tricky thing with strengthening the gluteus medius as it relates to the IT band syndrome is that there's a lot of different ways to strengthen the glute medius. There's side steps, there's standing leg kicks with a band, there's side lying leg raises, there's side planks, and there's side planks with a leg raise. There's a lot of different things to do. And in my experience, the exercise that really helps strengthen the gluteus medius most isolatedly for IT band syndrome is if you do a side lying leg raise with your foot back up against the wall. A gentleman named Jeff Cavalier on YouTube has a really good video about how to properly position the leg and your hip for completing the side lying leg raise in a way that really maximally isolates the glute. So you can check out that video, but the essence of it is you lay on your side, you are a little bit away from the wall, your foot presses into the wall, and then you slide your leg up the wall. So your hip is in a little bit of extension, you raise the leg, your toes pointed down a little bit, and what you can do with this exercise is really isolate the glute medius, and you can also add ankle weights over the course of time to make this that muscle in that exercise harder and stronger. Okay, so glute medius strengthening is a key focus in the rehab for IT band syndrome. But number 2 is, in my opinion, the most overlooked aspect of treating IT band syndrome, and one of my favorite things to educate patients on who are struggling with IT band syndrome, and this often makes a massive difference over the course of time. And it is crossing your legs while sitting or resting. So this is one of those lifestyle factors, and this is one of the unexpected contributors to IT band syndrome. The act of crossing your legs, whether it's right leg over left, leg left over right, doesn't really matter, but that crossing of the legs just puts a very subtle tension and pressure on the IT band that, if you sit in that position for an extended period of time, can just be irritating. Now, it might not even be irritating as you're sitting, but it just has a cumulative effect on the IT band over the course of the day and over the course of weeks. So pay attention to how you're sitting if you're struggling with an IT band syndrome. A lot of people have desk jobs nowadays, so they might cross their legs under their desk, or if they're in a lot of meetings, or maybe they're wearing a skirt or a dress and they have a tendency to cross their legs. That positioning can simply irritate the IT band, and making a conscious effort to separate your legs and just kind of straighten them a little bit can be the X factor in actually helping your IT band syndrome improve over time. We could do a lot of glute medius strengthening, but if you're doing this and you're not really realizing that it's an irritant, it can kind of just keep the IT band irritated for much longer than you would expect. So noticing that you're crossing your legs and then separating them can be huge. This is also true with resting in general. So if, let's say you're sitting on the couch and you notice you cross your legs, or the way that you happen to sit is a little bit, diagonal, if you will, and there's a little bit of crossing midline, or maybe your leg is kind of rotated in a little bit. Those kinds of positions can subtly irritate the IT band. So just being mindful of that and straightening your legs out is an important factor. Okay. Then the third unexpected contributor is downhill walking or running. So going back to the patient of mine that I was referencing at the beginning, who I've been working on her IT band with, is when this started, she had gotten a new treadmill in her house that allowed some degree of a decline, and she was doing some guided Grand Canyon hike on the treadmill that basically was downhill for the first, however long of the video and the hike. And that in the moment may not necessarily feel particularly provocative, but if done repetitiously and for an extended period of time, can be extremely irritating, especially those of us who live in flatter environments. When we introduce these hills suddenly, especially the downhill, it can simply be too much too soon for the area because it's not really used to it. So doing a lot of downhill walking or running, or doing downhill walking or running suddenly when your body isn't really prepared for it, and then doing a lot of that, can be an irritant in the IT band, in IT band syndrome. So the three different unexpected contributors are gluteus medius weakness. A lot of people already know that, but if you don't know that, that's really the muscle to strengthen to get out of the IT band syndrome. Crossing the legs while sitting and resting can, in my experience, be a real X factor for people to modify during their day, especially their work day, to minimize their IT band irritation. And then downhill walking or running, if you happened to start doing that all of a sudden, or let's say you're training for a race that has a lot of hills and downhills and you're really loading the downhill, then maybe that could be a little bit too much. Or even if the route that you typically walk or run has some steep downhills, it might be worth it to change the route or to modify the workouts a little bit, at least in the immediate term, to let the IT band calm down, and then you can reintroduce it over time. So if you've overlooked any of these three things in the treatment of your IT band syndrome, make sure you try this out, address it, and know that it's not going to be a silver bullet fix. It is something that will take time to play out. So just be mindful of these three factors and your IT band syndrome will be improved. If you found this video helpful, give it a like. And if you think somebody else who is struggling with IT band syndrome would benefit, send this video over to them. Thanks for watching.